Acne is an absolute bread and butter work of any dermatologists, and we see acne patients on a daily basis. First thing I say to all my patients that I see with acne, no matter what kind of breakout they have, that it isn't their fault. And that's because I see too many patients that attend after years of battling with their acne, who have changed their diet, they've changed their lifestyle, they've changed their pillowcases, they've been scrubbing their skin, and they have gone through tons of different over-the-counter products with no improvement. The second thing to say is that whilst the occasional spot can often be addressed with the right skincare routine, acne itself is still a medical condition. So if over-the-counter products are not helping within a few months, or if you have severe acne or even scarring, you absolutely must seek medical advice. Now, there are a number of over-the-counter ingredients, so things like benzoyl peroxide, salicylic acid, but even zinc and niacinamide. Now, salicylic acid is actually a really great start, and you can often find it in cleansers over the counter, but it's also available as sort of a spot treatment. Benzoyl peroxide is also very good. It can be a little bit irritant, so especially if you have dry or sensitive skin, I would recommend trying on a lower dose, so just 3% onwards. You also need to be a little bit careful when you're starting to use it because it can be a bit messy and it can bleach your clothing and even your hair. Niacinamide is a great ingredient because it's quite calming to the skin and it can help the inflammation of your skin, but it can also help against spots. Now, there is a very small amount of people who do react to niacinamide or who find that it actually gets worse. So if that's the case with you, just stop the treatment. Finally, zinc is another really good ingredient. There are some soap formulations or even creams available, and particularly for those of you who suffer from a little bit of seborrheic dermatitis as well, it can be a really good combination treatment. With any ingredient that you use for acne, so any treatment, it's really important that A, you use it regularly, and B, that you use it for at least a 6 to 8 week period, and ideally a 3-month period, and that's how long you need to really see whether something is effective. I far too often see people coming to clinic who have used quite effective things, but they've just not used them consistently or not long enough to know whether it's beneficial. There are a number of acne ingredients that are really effective against acne, but are mostly available on prescription only. Retinoids, and then particularly adapalene and tretinoin, are prescription strength topical creams or gels that can be used to treat acne. Now, they work by accelerating new skin cell growth. So they speed up the removal of your dead skin cells and debris that essentially can block your pores. And they are by far the most evidence-based treatment for acne. Now, on prescription, they are available either on their own or in combination with other active ingredients, and your doctor will prescribe you the most appropriate one. Now, they are strong and they can lead to irritation initially, but again, if you're starting them gradually and if you're using them in combination with a really supportive skincare regime that your doctor can advise you on, then you should be able to tolerate them with no problem. The next ingredient that I use for acne is azelaic acid, and that can be really helpful, particularly for people who have a tendency to sensitive skin and dry skin. And also particularly for patients who have an overlap with rosacea, for example. It is also a really good ingredient to use in acne for people who have a tendency for post-inflammatory hyperpigmentation. So these are the brown spots that some people develop after they've had a acne spot. So finally, topical antibiotics such as clindamycin, for example, or erythromycin can also be used for the treatment of the inflammatory component of your acne, so particularly redness and the red spots. We sometimes prescribe them as a single product or as a combination product, but we would never ever prescribe them as a treatment on their own because of the danger of resistance to the antibiotics, and also because of their ineffectiveness if they're used on their own. I hope you enjoyed this, and I'll see you next time.